Early on in my career, it definitely felt as though people thought when I would team up with industry, I was teaming up with the dark side. It always bothered me. And maybe it bothered me because I came from the engineering world. And so I had a different perspective. Maybe it bothered me because I knew that I was in academics, but the technology was not. And then an effort for me to bring technology into the hospital, I had to team up with them, but it was never the necessary evil in my mind. Like, it just made sense. And for them, it made sense because they wanted clinician stakeholders. They wanted the feedback because it was a win-win. Really, physicians are the difference between a health tech company and a tech company in healthcare. And that value cannot be understated. That can be success or failure for a startup.
Welcome to Startup Physicians. Please like and follow our show to join our community of physicians who are reimagining healthcare delivery. Hi, everyone, and welcome back to Startup Physicians Podcast. I'm your host, Dr. Allison Kerfman, and I am really excited to be joined today by Dr. Alyssa Abo. She, like me, is a pediatric emergency physician and has had a really incredible career with being able to contribute to startups and venture-funded ideas in a lot of different ways. And so, Alyssa, I'm just so happy to have you on today. Thanks for joining me.
Thanks so much for having me. I'm really delighted to be here, and I'm glad that you got the pink memo. So that's good. We did not plan this, but I'm glad that we were thinking the same thing this morning.
Absolutely. So I think back to when we first met, and I'm having trouble remembering what conference it was, but I remember somebody meeting me and being like, oh my gosh, you're a peds ER doctor who's heavily involved in startups. You have to meet this person. And so I know we connected, and I was just so impressed by your story and your background. And we've stayed connected over the years and watched each other's careers grow and different things we've been involved in. And I thought you'd be the perfect person to come on and share a little bit about kind of the journey you took, because a lot of the physicians that listen to this podcast are in more traditional settings and are just kind of curious about startups. And what I've really noticed is that there's not a lot of really clear pathways to get involved in startups if you're in more traditional practice. And so I love to highlight the stories of people like you and your journey to share a little bit about like how you got into this field. So I'd love if you could get started just by going back as far as you went to talk about your career journey and how you've ended up here.
It's funny that you said go back as far as you want, because this actually started for me when I was a kid, which is probably hard for people to believe. And they, really like, did it really start when she was a kid? But for me, it really did. So you can imagine as a girl in the 80s, I was all about the electronics. I had ColecoVision and Atari. Nintendo is cool now, but I mean, by the time we got to Nintendo, I'd already been through multiple iterations of these different electronic toys. And then I also was always tinkering, right? So I've always been a tinkerer and a tech nerd. I think one of my earliest other toys that was not electronic, which you'll probably appreciate, was a transformer, which then like collapsed down into an ambulance. And so, I look back and I'm like, oh, okay, so pediatric ER, check, like digital health, check, like devices, check. So for me, it really started early on. And I would say that actually set me on a path of STEM as a kid. And we didn't call it that then, right? I remember applying to engineering school and thinking, I don't think I know any engineers, and not even really fully appreciating what that was. But it was the advice that I had received in high school. Hey, you're focused on science and math and you gravitate towards that. So you should consider engineering school. And so I did. I went to engineering school. I was in the bioengineering program at Penn. And I'm so grateful to this day for that experience. I think for me, it just changed my perspective. It changed the way I thought from a very early age. It was all about critical thinking and teamwork and a lot of the values that I think have helped me now in the startup space. So that's how the journey started. And I love this two things that you also mentioned of it's not always linear, which I think in medicine, it tends to be sometimes linear, or the expectation is that it's linear. And then the part about being curious. So I will sort of weave both of those in. So from engineering school, then the question was, what comes next? And it's interesting. I talk about this a lot, that when I graduated engineering school, had I known I could be doing things like I'm doing today, maybe I wouldn't have pursued medicine. Maybe I wouldn't have then gone on to medical school. But at the time, what I knew was that I really loved people, and I still do. And I wanted to be patient facing. And even then, high school, college, I was always working with kids in some capacity. And this idea of going to medicine, like going to medical school, pursuing medicine, and then later being able to take care of kids was always sort of my North Star.
Yeah, I agree with that wholeheartedly. I think kids are the best.
Yes, I would agree with you.
I
And,
think
you know,
it's the best investment that we could ever make is to invest in society's children. But that's just my little
100%.
plug for pediatrics.
Totally. And we can have another conversation on that, because it'll never make sense to me why we don't invest more in children. And it sometimes feels like it's us versus them, but like we were all them one day. So like it doesn't add up. And I feel like you and I will continue to fight the good fight. So, but anyway, now that I'm sharing some of these stories, I actually don't talk about this a lot. I forgot about this, but my senior project in engineering school was developing an exercise program for kids. And at the time, we didn't have all the things we do now. So it was pretty novel to use PowerPoint in a way that kids would go through the slides. I put different math equations up there. And so it would be something like do 2 + 2 jumping jacks. And so it was a little bit of math and fun and exercise all in one. And I was studying how they evolved over time and using the presidential fitness test. Not even sure people do that anymore. But anyhow, so you can see that I was always sort of meshing these worlds of pediatrics and engineering and medicine. And that would really continued throughout my career. So from there, I went to medical school. I actually went to medical school in Israel, which was fascinating in its own right. I think being in an environment that was so tech oriented, even then, which was 20 some odd years ago, really started to instill in me like how you can actually use technology in medicine. So I would always be looking at the different tools and shiny objects that people were using and being like, oh yeah, that's cool. And then thinking like, do we have that for kids? So again, a lot of this was just sort of infused in the environments that I was in over the early parts of my career. And then after that came back to the US and started off in pediatrics at Yale. And, again, it's fun to talk about this story because every layer of it matters to like how you get to where you are, even though you would never know that 20 years ago. So
yeah, you didn't know it at the time, but something
no,
was there. There's seeds along your whole pathway that got you to where you are.
yeah. And the themes are the same, right? So like I'm sharing, what I did as an engineering student, but then fast forward to Yale and I could see a little bit of ultrasound being used in the adult world. Again, I was in pediatrics. At this point, I wasn't peds ER, but when I was in the ER, it's like, we have this ultrasound machine. People aren't really using it. What could we use it for? And ended up doing a project using ultrasound. So someone was there to teach me how to use it and looking at the interspinous space in kids, right? So looking at the back and trying to figure out when we do spinal taps, what's the best position? And when we figured out what the position was, I teamed up with engineers to create a device.
Let's pause there.
Okay.
That sounded like a big statement that most people would be like, wait, rewind. You teamed up with engineers to make a device. Like everyone was following up until like someone taught me to use ultrasound. I was seeing it in the ER. How did you make that leap? Where'd you find engineers and where did you find the idea to make a device?
Yeah, so it's a great question. I honestly think we just, my mentor from the emergency department at Yale. So Karen Santucci was my mentor and Lei Chen was one of the other mentors teaching me ultrasound. So the two of them were sort of brainstorming, okay, we'll use ultrasound to look at the space. But then I remember Karen saying to me, but if you could figure out what space is the best space, maybe we can, build a device to hold kids in that space, in that position to then maximize the space. Okay, that sounds cool. And so we just looked at Yale's like roster of engineers, really. And I think I must have just cold emailed people to find someone who was willing to team up with me to do this. And it was amazing. And we actually built a prototype and we had a provisional patent. And I mean, it taught me a lot about the world.
You were a resident at that time?
I was a resident.
So this is, one interesting thought is that this is essentially something that is very, very, very common experience to all of us in medicine and in training, is that you're, contributing to some sort of a research project, and you're, using your mentors to kind of help guide your idea of like how something could actually be really useful clinically. But you went in a direction that, like, most people would publish this as a paper, which I'm sure you did, but
Did.
you added on another layer of like, what if there was a thing I could make that would
Yeah.
make this thing happen? I think that that's this very like entrepreneurial and startup sort of inflection point. You didn't know how to make a device, you didn't know how to get a patent, you didn't know how to create a prototype, you didn't know how to do any of that, and probably your mentors didn't. I don't know, I'm assuming probably hadn't done that whole thing either. But it was all about like, okay, well, what would I need to do? Well, I definitely need to find someone to help me. How can I find someone? I'm going to look through the directory of engineers. And so it's just identifying like one step at a time. And that probably was a very like formative experience for you.
For sure, 100%. And again, it was building off of the things that I already knew, that as an engineer, we weren't doing things alone. We were always working in teams. And then as a physician now, again, to your point, like I knew that I couldn't just build this device from scratch. And, maybe people listening think like, well, but I could do it by myself. And you might be able to, but there's so much value in the collaboration and in the teamwork. And it is, we'll talk about this later, but one of the transferable skills I think that we are so used to in medicine, especially for us in the ER, it's a team all the time.
Mhm.
The worst situations that we find ourselves in, we rely on every member of that team. And I would never want to be in a resuscitation without a strong team, right? So how do we sort of take what we are so used to and leverage that in the industry side and the startup world? There's so many similarities there. But yes, so you're right. So teamed up with engineers, filed the patent. I mean, the learning curve was straight up. And when I moved on to fellowship, I didn't know what to do with this idea. Like I was not in a position to start a company. I didn't know all the things that I know now. The idea a little bit died when I moved on for training because I didn't know what to do. And ironically, I was at a conference a few years ago and I was there with a different startup. I sit on their board. And sure enough, the booth next to us is the company that built a device to hold babies in place for spinal tap.
Oh my
And
gosh.
it's so ironic. It's like, wait, I know them. And I knew them because I was judging for MedTech Innovator and I saw them also. And so, when I first saw them, I was like, good on you, because 20 years later, I didn't do anything with this. I'm so glad somebody did. But then you don't know, going from MedTech Innovator in early stages, how far they've come. And then they were sure enough right there at a booth
Oh, that's
next,
so funny.
so
Well,
fun.
and I think that what you're describing is also something that has some people have brought up to me, that like sometimes, so a lot of physicians have ideas of something that can improve care for their patients and would maybe be willing to like initially develop that idea, but they don't want to go found a company. And the thing that I want to emphasize is that there are opportunities to take those ideas and actually find ways to hand them off in a way that you get compensated for it, but you don't have to go be a founder, you don't have to go fundraise, I mean, a lot of people don't want that sort of life or responsibility. But I feel like by creating this group of physicians that are doing this work and are working with firms that are wanting to do this sort of physician founded ideas, like you could have handed that idea off. You had a prototype, you had a patent.
Yeah.
You could have been like, hey, I want to be involved as an advisor, but I don't want to go like build this because I am a fellow. You were probably starting a
Yeah.
family. You were like probably had a lot going on, but then you didn't. And then
Yeah.
somebody else did it. So
Yeah, no, and that's exactly right. And I mean, at the time, there was no one to mentor me through that process to say, okay, you have this idea, you've built the prototype, and here's an option that you could pursue. There was none of that, and I think probably a lot of people listening, like, don't, even know what it all entails either. Like your point of like, some people just don't want to be a founder. I'm not sure most of us in medicine would even know what that means. I had no idea what entailed, like what being a founder entailed till I actually started working inside startups. And I mean,
Yeah.
I had worked with startups for years before that. Right. So, and we'll get to that, but no, I just the learning curve in all of these things is steep, and it doesn't mean that it can't be learned. I think for a lot of the reasons you've mentioned in other forums and other podcasts you've had, like, of course these skills can be learned if you don't know them already, but at what cost? What are you willing to give up? There are only so many hours in a day, and once you know more about what it entails, people may not. You're right, like want to be a founder. Like as it stands right now, I'm not sure I would want to be, the founder of a new startup, of a new like that's a huge lift. And,
Yep.
I kind of like the way I'm doing things. So, but mad respect for people who do. So from Yale, I went up to Boston. I was at Boston Children's and I did fellowship in Peds emergency medicine. And now I had a little taste of ultrasound, but still it really wasn't a thing. And now as an emergency fellow, I was rotating through the adult emergency departments and really people were starting to take me under their wing and starting to teach me more about ultrasound. And that really sort of sparked this interest in me. Okay, how can I bring this technology into the pediatric space? And I also felt as though there was enormous value in ultrasound. If I didn't learn it now, that it was going to happen at some point, and that I would be relying on med students, interns, trainees to be teaching me. And I really wanted to stay ahead of the curve. And so it really all, for me in this instance, just boiled down to the curiosity of how do I do this? Who will teach me how to do this? And then how can I translate this into pediatrics?
What you identified was a up and coming field within your field, because ultrasound has become like a very important part of emergency medicine. It's specialized and there's a lot of career tracks available for people that become ultrasound trained. It reminds me of, when I was at that same stage in fellowship, I was identifying telemedicine as and digital health as being something that I felt like was really going to change my field. And I really wanted to connect with people who is actually doing this. Cause this was like 2014, people were not doing telehealth, especially in kids. And so I did like reach out like nationally to find people who were doing that, to mentor me and to help, to co-create ideas. And it sounds like with ultrasound, you just saw this potential for something that was going to grow and really change your field. And you're like, I'm going to get on that train.
Yeah, exactly. And there's a few of us, like a handful, and we were leading the effort.
And
And
you become a national expert when you get on a train of something like that early.
100%, and people will sometimes refer to this like very small group as like, the grandfathers of pediatric POCUS or the early pioneers, early adopters. And it's so humbling to hear those things, right? Because to say them out loud feels like very self-promoting, but it was just a handful of us. And at the time, there had only been 2 other people to do peds emergency medicine and then go off to do an emergency ultrasound fellowship. So I decided to do that because I thought, again, it was this, well, you could teach yourself or have others teach you and be the grandfathered in. But I thought if there was a way to actually learn it in a more formal way, that seemed to be the better choice for me. And so I did. I went out to UC Davis for a year and I studied emergency ultrasound in a fellowship. And it was great because it was through the UC Davis Emergency Department, which is pediatrics, adults, all in one. Although there are pediatric emergency attendings like you and I are trained, and it's just a wonderful place. And the fellowship was really geared towards adults. And when they were willing to take me for a year to teach me ultrasound, then the idea was, well, then I could share a little bit more about pediatric emergency medicine and bring some of those folks who were doing emergency ultrasound into the pediatric ER. And how could we together figure out, okay, if we can teach you ultrasound, being me, then how can I think with them around how I can use this in pediatrics? So that's really how my career started. And the next 20 years in academic medicine were, for the most part, focused on ultrasound and building the field and the operations and the education and everything that had to do with this
And
technology.
publishing.
All of that, right? It started off as you would expect in academics on the educational side of research, publishing. And I was never much of a researcher, but definitely, did my fair share of studies, but more on the white papers and the policy statements and the how to, because none of that existed either. And then very quickly for me, I just love the operational side. Like, this equipment, how could we make it better? The operations of, we store, we take images, like, where do they go? In part of my attending life in New York, I was in a place that was quite robust in ultrasound. And so they were billing and generating revenue. But to do that, you had to document properly. And what were the elements needed for that? And what are the CPT codes to build? And so very quickly, I kind of went from the educational side to the operational side to the business side. And there's definitely some overlap there, but really trying to figure out, okay, there's a technology that can help patients. That's my North Star. I need this to help me do a better job taking care of kids when I see them in the emergency department. And so knowing that, I had to figure out all of the pieces of the puzzle. And now when I'm working with other technologies, a lot of that premise is the same. There's a
Yeah.
technology that needs to get to patients because it can help them. And if it can't help them directly, how can it help those providing care to them do their job better, right? So in my mind, it has to be one of those two things, ideally both. But how can we put all the pieces in place to get from A to B?
Absolutely. And I think that statement that like that the patient care and how this could help patients is always your North Star. I think that a lot of physicians really, really resonate with that, if they have ideas on how to improve medicine, it's usually something related to like direct patient care or something that directly affects patients. And I think that is such a needed perspective in the startup world, is like how some of these things actually relate to the patients, to the stories of the like for you, the kids you're serving, and you have use cases, you have, actual clinical scenarios that you're drawing from to build your expertise. And at what point did you actually start working with companies on these concepts?
So great question. So I started my career off in ultrasound, and now we need to teach people, which means that we need to put on conferences. And so, in an effort to put on conferences, we needed machines. I will say, even before that, we had some relationships with ultrasound companies. We would be a beta testing site, things like that. But the relationship for me really grew when I wanted to partner with them to be able to highlight the different technologies, the different equipment, the different ultrasound machines. Some had different bells and whistles, and another one, regardless, like, it was important to me to be able to teach hands-on ultrasound. In an effort to do that, I started teaming up with the companies. Over time, they would then say, hey, we need medical advisors. Can you be on our medical advisory board? And so then the relationship went a step further. Let's talk about that for a second. I think sometimes, and I think this is changing, at least I hope so, but early on in my career, it definitely felt as though people thought when I would team up with industry, I was teaming up with the dark side. And it always bothered me. And maybe it bothered me because I came from the engineering world. And so I had a different perspective. Maybe it bothered me because I knew that I was in academics, but the technology was not. And then an effort for me to bring technology into the hospital, I had to team up with them, but it was never like the necessary evil in my mind. Like, it just made sense. And for them, it made sense because they wanted clinician stakeholders. They wanted the feedback. They wanted to bring their equipment to show all the bells and whistles because it was a win-win. And I think that was a huge part of my mindset early on that has not changed.
Personally, I believe it's not productive to vilify any like group within
Mm,
healthcare delivery, whether it's payers or administration or
yeah.
other fields, because like you said, it's all, we're all contributing from our own perspective of a healthcare team. So I felt the same way, that people would be like, oh, you're a pediatrician, you're working for a private equity firm. Like, that's But I was like, well, I did this at a nonprofit and it ended up not working. And if I want to get this solution to kids, like, yeah, I do need to work with someone who knows how to make this financially sustainable.
Yeah, 100%. I totally agree with you. So that was the majority of my, I would say, academic journey. And I, went through the academic part of becoming a full professor. And that was really important to me. I felt like if I was in the academic world, it was important to follow the linear path too. But in the meantime, my own career path was sort of taking lots of turns and zigzags. And over time, I could see the value of the different things coming together. So medicine and engineering, but I felt like business was a big part of that and ended up pursuing an MBA so that I could speak the 3 different languages, because I think physicians are in a position when working with industry or startups of translating the clinical needs. And I felt as though if I could translate between the physicians and the engineers and then the business minds, then it put me in a bit of a different position. And so once that happened, I was starting to get tapped to then kind of do what I did for ultrasound for other technologies. And so my last few years in the academic world were really focused on bringing other emerging technologies into the hospital. And so that's really how I started getting into the startup part of it. And I'm grateful, for this conversation to kind of give the background, because I think a lot of physicians are doing things that would lend themselves well to bringing in new technologies into academics or to community hospitals, or to, figuring out a way to collaborate and share ideas and insights so that technologies being built fit an unmet need and actually solve a problem.
And I just want to go back to so I also have an MBA, but as I've been working with a lot of physicians, I think that there is some limiting belief out there for a lot of physicians that, like, I don't have an MBA, so I can't work with business or industry. How would you react to that? And it's probably served you a lot in your career, but for people just getting started, what do you think about that perspective that, like, oh, the barrier is that I don't have an MBA?
I don't think it needs to be a barrier. I think people who do not have an MBA are well versed in many other things that would make them incredibly valuable to the startup community. So I agree with you that it's not a necessity. I also think, though, people in the hospital setting that have a lab, that run a division, that are managing budgets, that are looking at numbers, probably have more experience in business than I did in the academic world. I was not in those positions. I was in different leadership positions in the hospital, and I was managing ultrasound purchasing and things. And actually, that really was a drive for me to get the MBA, because from a hospital-wide level, people were asking me, well, what's the ROI on that? And I was like, what are they talking about? So I think if you're in the position of crunching numbers, managing budgets, you're understanding, return on investments for things that you're purchasing for your hospital right now, then you're in a really good position to understand some of the finances in business for startups as well. Having said that, if the whole business world is just completely foreign, then I do think it's worth investing some time to understand the different terms, and you don't need an MBA for that, but I would definitely do something so that you understand the language people are speaking, because I do think that each part of that is really important. I think if physicians just sort of have blinders on to the financial pieces of it, then I think that's a little limiting in the scope of their ability to actually give feedback in a way that makes sense.
Yeah. And there's all sorts of ways to pursue and start pursue an understanding of some of those things. I think that sometimes as physicians, our natural reaction to wanting to do something new is, I should get a new degree for that, or I should do a new fellowship for that, or I should. And so, I mean, it could be as simple as taking a course or getting a book from the library.
And I think many physicians are, lifelong learners, are many people. But again, I feel most comfortable speaking as a physician because that's fundamentally like what I am. And I think that that's just inherent to our being and how we're wired. I mean, most of us have been in school for over 20 years if you add up all the training. So you're right. Like, why not just, get another degree? But I don't think it's necessary. And I do think it's an investment. But I do think that if someone wants to pursue it, it's also not wasted and can be incredibly helpful and valuable, and also potentially open doors.
Yeah, for sure. So, as we're kind of getting to the end of things here, what sort of roles did this lead to for you, and how have you seen ways that physicians can contribute to startups and really provide value?
As I mentioned, I started becoming more involved in other emerging tech and I started working really closely with startups while I was still in an academic setting. And that looked a few different ways. I would either judge competitions and just see startups that were out there and getting started and they just wanted some clinician feedback. And I still think that's a great way to start. And people ask me often too, where to start. Definitely I would check out MedTech Innovator, the different accelerators, incubators, and a lot of them would want to have physician feedback. There are actually a lot of initiatives now out of universities. So I was recently asked to sit on an industry roundtable, coming from the industry side. But what the goal of that is getting feedback to the engineers or physicians in academic settings who are building out these different ideas and then figuring out like what to do with them. So I would definitely encourage people to get involved in any way that they can. As far as how I got involved, I started working with startups. Over time, I got recruited to go in-house for startups. And I would say, I think it makes a lot of sense to start off as an advisor. But if an opportunity presents itself to go in-house for a startup, meaning you take a part-time role, which people often refer to as a fractional role, it's totally worth it because to go in a startup and actually see how it works, it's all hands on deck and the learning is just like an MBA, but different because it's all the things you actually don't learn in business school. I think that would be, an enormous value for folks who are trying to get into the space. And then the greatest difference between a health tech company and a tech company in healthcare, in my mind, are the clinicians, a lot of which are physicians, right? And if there are nurses, pharmacists, techs, anybody listening to this who provides patient care, I think you're an enormous resource in the startup space. But I know this is, geared towards physicians. And so I would just say, like, really, physicians are the difference between a health tech company and a tech company in healthcare. And that value cannot be understated. That can be success or failure for a startup.
Absolutely. And we both have had experiences seeing companies that maybe didn't have clinician input at an early enough stage, or maybe ended up solving the wrong problem. And I think that there's enormous value, like you're saying, in clinicians who see patients and know the day to day and the workflow and the patient journeys and patient stories and all the struggles and challenges to be involved in helping design these solutions.
I agree. And the last thing I'll say is just to be curious. I think that has served me so well. And it wasn't something I tried to do. I didn't know that I was going to be passionate about ultrasound. What I'm really passionate about is bringing technology to people. And that became more clear to me over time that ultrasound is a way to do that, but there are other technologies to do that. And I really do. I love understanding how things work and I love technology. And again, this is sort of infused in me from when I was a kid, but just be curious. If there's something you don't understand or something you want to know more or something you see, like, go after it. I mean, I literally have followed people out of hotels, not in a creepy way, but they were like on a device to help you walk instead of crutches. And I was like, that's just so cool. And I just walked after him and I was like, I'm sorry, but like, can you just show me like how you're using this? Because I'm fascinated by it. Like, find those things that excite you and then pursue them a little bit and see, and maybe they will become a passion. Maybe they will become an advisory role. Like, it's hard to know, but just be brave and get out there and try new things and just be curious.
There's no shortage of information to find
Yeah.
either. Like it's just like when you wanted to make a device that supported the research paper you were writing or the research study you were doing. It was like, how do I do that? Okay, well, like back then you probably didn't have Chat GPT or a really advanced Google and all of these other things. And so now it's like just go search it and go see, like, how do I get a patent? There's probably a step-by-step guide online, and we are good at synthesizing information as physicians. The other thing I wanted to ask you is what you see as kind of the most common transferable skills for physicians that are in more of a traditional setting who might be sitting there thinking like, I don't have anything to offer. Like, this girl has an engineering background and she's got an MBA and she's got all this other like training. But I feel like what physicians need to hear is how much of what they do on a day-to-day basis is actually transferable to the startup and business community.
At baseline, I think there are a number of skills that physicians have that are just so innate in what we do that in a way we don't recognize it. And whether or not we take it for granted, maybe, but I think it's a part of who we are, right? So generally speaking, physicians are strong at teamwork, leadership. I think generally speaking, physicians are analytical. They have high emotional intelligence. They're compassionate, right? And again, it's not one size fits all, but I think that physicians and inherent to physicians are a lot of those qualities. Now, you could say though that those qualities are inherent to engineers or other people too, and that would be also true. So when I think about the skills physicians have, they are many. At the end of the day, physicians diagnose and solve problems. That is what we do. We take care of patients, we build trust with those patients, and then we diagnose and solve problems. And I think that's where physicians differentiate themselves. So when I think about physicians in startups, I think about how they can leverage this idea of I diagnose and solve problems. And here are problems that I see. Or if you're going to tell me about your solution, let me help you understand if that solution actually solves a problem that I have. And it's that clinical translation piece where I think that there's enormous value. And I also think it's important for startups to think early about having those physicians engaged because physicians build their relationships on trust. And so they need to trust the technologies they're using. And in turn, their patients need to trust them that they understand the technologies that they're using. So for me, physicians can be enormously value in sharing their expertise to the startups. So startups are building to solve the right problems. And then in turn, physicians are enormously valuable for startups so that they're on the right path and they don't fail early because so many startups fail because they're either solving the wrong problem or they don't have the clinician input or they run out of money, which is obviously like the elephant in the room. But at the end of the day, I think that relationship can be so powerful and it can be a win-win. And the most important part of all of it is getting the right technology to the patients, which I think really aligns the goals of the startups and the physicians, because at the end of the day, this is what we're all trying to do is make healthcare just a little bit better.
That's amazing. Well, I am so grateful to you for your time and your expertise and sharing your story. For people that want to reach out to her, she is on LinkedIn, and that's probably the best way to get a hold of her. We'll put that in the show notes as well as her website. Thank you so much for joining me today. I'm sure many people were inspired by your story. And for anyone that has ideas in healthcare, like, just realize that being curious and pursuing those ideas and finding the information along the way is completely an option to you. So thanks, Alyssa.
Sure, my pleasure. Thanks for having me.
Thank you for listening to Startup Physicians. Don't forget to like, follow, and share.